So now I'm going to page 49. So it says subtalar joint manipulation, and the subtalar's in quotes, and it's actually a really bad name. It's just not like I'm pulling the calcaneus away from the talus. I'm not treating the subtalar. I'm actually going to pull the talus, or the rear foot, and calcaneus away from the ankle mortise. So you're locking onto the neck of the talus and pulling. So one of the residents can come up and demonstrate.
Okay, so talar curl distraction, like Christy said, global loss of motion, particularly if someone's in like a brace or a boot or a cast or something like that, they have limited dorsiflexion, plantar flexion. So obviously distraction, you're trying to get all directions. So what I typically do is my hand placement comes right below the tib fib joint, kind of right on top of the talus. So you want to be in that, if you kind of dorsiflex, you want to be right in that hinge right there. Thumbs just first and fifth met, kind of keep your foot even. And you dorsiflex them up a little bit out of their open back position with more plantar flexion. So you dorsiflex them up. You kind of play with pronation, supination to find a bit of a barrier. What I'll typically do is just do a little bit of joint play, and that's kind of how I do my pre-manipulative hold, kind of a grade 4 mode. See how that feels? Does that bother you at all?
Yeah, that's fine.
So keep her in dorsiflexion. And the way I was taught, and you can do this in standing or sitting, but I do it in sitting. So I kind of lean back, get to that barrier, and I just drop my elbows. So it's a bit of a elbow drop and scoop. But if I think about just dropping my elbows, it's a quick, to me it just makes it easier to do it quick instead of just trying to pull it this way. I don't know, that's the way I like to do it, but there's many ways. So just pull in, elbows are here, and then a quick drop.
Got it.
Winner.
Winner, winner.